and welcome to another inspiring episode of NYSC Half Hour. I am Nkem Okwogo. On today's episode, we highlight the remarkable community development service intervention of core Dr. Vincent Emmanuel Chidera. Dr. Chidera, as he is popularly called, is a medical doctor with a passion for public health. He is a native of Abia State, trained in the University of Calabar, and is currently serving in Dakwa community in the Federal Capital Territory, Abuja. In his place of primary assignment, El Hussein Specialist Hospital, he has embarked on numerous preventive healthcare service delivery as part of his community development service project. His story will inspire you. Come with us.
My name is Vincent Emmanuel Chidera. I am from Abia State. I was born and raised in Taraba State, and I schooled in Calabar, University of Calabar precisely. I'm currently serving in Abuja, Dakwa in Abuja. I was posted to El Hussein Specialist Hospital here in Dakwa. It is just along Imam Abubakar Street here in Dakwa. When I came here, I was very delighted about the community because it had the similitude of a rural area. We had a lot of indigent people here and there, and I felt it was a very good opportunity to touch lives. There were a lot of issues staring me at the face when I got here. A lot of issues, so many of them. And I began to give attention to them one after the other. Even though a lot of them were done unofficially, but what was more significant for me was the outcome, the impact it was making. So I was more focused on what I could help the community do. And because I'm a doctor who is also an SDG enthusiast, I was more focused on SDG problems, global issues that were, bedeviling the community. And I began to attend to them one after the other.
Faced with the high rate of fatal cases of home birth delivery and a high prevalence of maternal mortality in the community, Dr. Chidera sought innovative ways to attract women to the hospital for antenatal care.
One of the first issues I had realized when I got to this hospital was that the pregnant women were delivering at home. There were a lot of cases of home delivery. And then they bring in their neonates after delivery, asking you to help them when complications arise. And I felt that the first thing to attend to was, helping them learn that it is better to deliver at the hospital. I ran a free antenatal care program in this community for 2 months, encouraging pregnant women and adolescents to come to the hospital for antenatal care. Everything they needed were given to them free of charge. And after the antenatal care program, I was thinking of a sustainability plan. So I felt that it is better to introduce an antenatal care package that is affordable by the rich and affordable by the poor. So we brought a structure of antenatal care that had the 50,000 naira package up to at least 5,000 naira package, which we felt that a lot of people could afford in the area. And even for those who could not afford it, most often we waived the cost and we offered the care. Our aim was to encourage them to continue coming for care after the free 2 months antenatal care we did. And that worked magic. All of a sudden, in a space of 2 months, we had over 50 women presenting themselves for antenatal care. And most of them, I can say, having stayed here for almost a year, were delivered in our hospital by my humble self.
Dr. Vincent came in as a core member, and he has been a wonderful person to work with. Throughout this project, we are working in hand together, and he's a very good person.
His passion for impact led him to embark on various outreaches to sensitize the people on COVID-19 prevention, free genotyping and blood grouping for 1,000 women of reproductive ages.
I would not forget the incidents of one Miss Aisha, a 16-year-old girl who presented with severe pains, and she was weighing less than 9 kg. It cannot be believed by anybody, but that was the scenario I saw here. And this little girl has been in this pain for decades, simply because her parents did not have knowledge of genotype and how it works and how it affects their children. Aisha was in pains. I tried to attend to her and help her using analgesics and all of that. But beyond Aisha, I felt there was need to help the community too. There was need to help them know what genotype means. There was need to also help them know their genotype. So we organized the free genotyping for 1,000 women of reproductive age group here in Dakwa. And by the grace of God, we were able to complete that process last month. And the results were mind-boggling. Over 30% of the women in this area have the sickle cell trait. Over 30%, which implies that 1 out of every 4 women you see here has sickle cell trait and must be careful on who she decides to marry. So all of these has been the things we have been trying to do in the community. Sensitize the women on why this is important, why they should give attention to their genotype, why they should improve their health-seeking behavior, why they should stop giving birth at home, encourage the traditional birth attendants not to take deliveries in the homes. They should refer them to the hospital. All of these are the things I've been trying to do here in Dakwa, and it has been an amazing experience for me.
The establishment of telemedicine, a hotline for ambulance service deployment in cases of emergency within the community.
When I came, I decided I was going to assist the hospital as much as I can. I brought a lot of policies, you can confirm that, which the hospital is operating on right now. And one other thing which was significant is that I built the website of the hospital, lucentralishospital.com. I built that website, and I introduced telemedicine and emergency system on the website, where people around can just call and then our ambulance goes to pick them. That has helped us a lot because we had a lot of emergency cases where the ambulance was able to rush and bring them. You know, most of these people have not been going to the hospital, so the ambulance has really been a very helpful system for us.
One thing I know about Dr. Vincent is that he's an optimistic person, very optimistic. He never say a thing and will not do it.
The NYSC program has been so relevant, especially to us in this hospital, because for the corpers that serve in this hospital, they have demonstrated so much commitment. They have showed a lot of discipline, and they have contributed immensely to the healthcare delivery in this environment. And to me, therefore, the NYSC is one of the most vital arms in this nation that has helped in knitting this nation together and also given youth the opportunity to live in places either than where they were born and bred. And it has helped greatly in unifying this country.
With the rise in cases of diarrhea, particularly amongst children in the community, Dr. Chidera identified open defecation as the root cause of the spread of the disease.
During the rainy season, there were a lot of cases of diarrhea disease. It was a trend that was visible and palpable. Most of the under 5 children that were coming to the hospital were presenting with similar GI symptoms. And I felt there was something that needed to be given attention. So I began to go around the community and asking questions. I realized that there were over 10 Almajiri settlements that were without toilets and were without bathrooms. So I located this very one because it had over 65 children locked up in very small, tiny 3-room apartments. And the population density was massive. I couldn't imagine that a place like this was existing. So I decided to interact with them. I asked them a couple of questions, where they defecate, how they ease themselves and all of that. I realized that they were using the gutters. And when it rains, there is usually a kind of flood in this area. The rain packs the whole thing and distributes it to the community. And then you have a lot of children coming down with acute diarrhea disease, presenting in the hospital. And unfortunately, we lost one of those children. That struck me and then, caused this infuriation within me that made me say, I must build something.
With support from the NYSC and members of the host community, Dr. Chidera provided a lasting solution by constructing 4 toilet facilities in the community.
Yes, there was pandemic and all the whole crisis that came up with the NSAS protests. It was difficult to find people to support the project. It was very difficult. But then I spoke to the children, the older ones among them. I said we could work this thing out, no matter how small. Let's get something for you guys to have where to defecate and also have your bath. And they were able to comply with me. They really worked hard. I can say that a good percentage of the things we did were done by them. And I'm really, really proud of them. I'm really, really proud of them.
At the commissioning, the Director General, NYSC, Brigadier General Shaibu Ibrahim, commended Dr. Chidera's efforts in alleviating the sufferings of the people.
During the COVID-19 pandemic, from the beginning of the COVID-19 pandemic, I have to suspend our orientation exercise. Corps members were mobilized nationwide to contribute to the fight. And when the history of those corps members who fought and are still fighting COVID-19, Dr. Chidera's name will be mentioned. Because Dr. Chidera is into everything. He sews, he produces face masks, he's into ironing, he cuts, and so on. Anytime you need corps members from the FCT, he's always there. NYSC always provide platform to corps members. And for those of them that are very serious and take maximum use of the opportunities, the sky is always the limit. So, Dr. Chidera, I want to once again congratulate you and I wish you the best in life. And I can assure you, you will continue to excel in life.
On behalf of the management, corps members, the staff and corps members nationwide, I want to commission this toilet that will in turn check open defecation in this community to the glory of the Almighty God. I hereby commission the glory of the Almighty God and for the use of the community. Thank you.
My name is Alame Idris, and the person that built this toilet, his name is Dr. Vincent Emmanuel Chidera, and we are very happy. May God give him long life.
This project is going to go a long way in the lives of all these children. They've been defecating up and down from streams to the roadside, but with this, it's going to stop all those menaces.
Coming to this community to find out that there are children who do not have places to defecate, and I mean, considering the health challenges, it has been a great source and huge inspiration to me. Yeah, I have plans of having projects. What I actually do is I start by volunteering in my community, of course, which is a huge way of contributing personally.
I am inspired about this project because I am someone that has passion for sustainable developmental goals. This project is in line with Vision 2030, SDG 3 and 6, which is clean water and good sanitation. I have always loved something that has to create solutions to all these diseases in the world today, according to what the United Nations goals are all about.
The National Youth Service Corps is for me one of the most amazing things I see in Nigeria. If you let me say, I would say that the NYSC is the only system in public service that is very functional and unique. Reason being that you cannot imagine the level of discipline in the NYSC, and that discipline was what really got me excited about the whole scheme. And you know, when I began service earlier last year, I was passionate about impact, and they love people who are ready to make impact. So then you don't struggle to make impact in the NYSC, because the people are even looking for people like you who want to affect lives, who want to touch lives. Just after we got out of camp in March, you know, I was called upon as the SDG governor. Say there are a lot of communities that the lockdown is affecting badly. We need to find a way to reach them. That's not a problem. That's what makes me happy. You know, immediately we organized forms and we bought bags of rice, bags of gari. It was a massive outreach at Karamajiji community. When we got there, we saw a lot of indigent people struggling to survive. And the materials we bought were able to sustain them for a while. And then over and over again, a lot of outreaches we were organizing. And then fortunately, we presented the proposal. I made the proposal to the Minister for FCT that we could mass produce face masks for indigent communities. As at that time, community transmission had become too obvious and evident. So I told her that we could produce face masks for them, and without them paying us, they should just provide us with the materials. And we made over 37,000 face masks during the lockdown. It was massive, and it was a lot of sacrifice. It was a lot of sacrifice. But all of the sacrifice was not a problem to me. What was important was the fact that we were touching lives, and lives were being impacted. You know, what I would say to fellow corps members and prospective ones, I have noticed that a lot of corps members, some of them are just after what they will get. Some people are just thinking, what is there for us? We were not after what we will get. I was never concerned about what anybody would give me. What I was more concerned about was result. The things I want to do, the things I am doing, are they making impact? Are they measurable? The impact, are they measurable? Provided they are, I focused on the impact and I gave it my best. All through the lockdown, I was working on face masks. I coordinated a team of 23 amazing young people. We produced face masks in the morning, in the afternoon, in the night. We were all out there trying to give our best. And even communities where they were not aware of the COVID, we organized outreaches and we went to them, we sensitized them. We produced hand wash, this liquid hand wash, and we shared it to those communities. We knew that most of them will appreciate foodstuffs, so we don't give them hand wash alone. We go with a few food materials which would also help them. So it has been an amazing experience for me. I must say, the NYSC is a platform that should be sustained by any government.
How thoughtful. The people of Dakwa community remain grateful to the NYSC and Dr. Chidera for adding value to their lives and promoting quality healthcare. Moving on, we highlight yet another inspiring story of corps member Ezekiel Adeshino. Ezekiel is from Kogi State and a graduate of the Federal University of Ilorin. He was posted to Nasarawa State, and even though hesitant to deploy, he took his deployment in strides and fully integrated into his host community. As the pandemic struck, he responded innovatively to the charge by the Director General to all corps members to work concertedly to curb the spread of the virus. Ezekiel decided to mobilize other corps members with relevant skill sets to produce respiratory and sanitization materials for the prevention of the spread of the virus, such as face masks and hand sanitizers. The items were distributed to vulnerable groups within the community. Let us meet Ezekiel.
I'm Bitomi Ezekiel Adeshogo. I schooled in the University of Ilorin. I'm from Kogi State and I study History and International Studies. When we were asked to choose, and I didn't even know, when we were asked to choose the number of states we were supposed to choose for mobilization, I didn't even know that I chose Nasarawa State until I saw Lafia. And I was like, what? Nasarawa State? And when I was coming, I didn't even know that it was, because I wanted Abuja. I didn't know that it was that close to Abuja. And I would say that the experience has been nice so far, because I've been from school, come to camp. Camp was fun. I met a lot of people. I interacted. I had a lot of experience. Like I learned a lot from camp. So my camp experience groomed me from where I am today. Skill acquisition and entrepreneurship development. Then I joined fashion designing, and from fashion design they were telling us that they were just like preparing us for because they were always bringing into our memory that there's community development service that we must participate. So then I was just trying to wrap my head around what I'm going to do, how my community development this is going to be like. I was groomed to know that wherever you are, you must be impactful. You must leave a landmark, because people don't remember you for what you give them. They remember you for how you make them feel. So that thing keeps recurring to me, and I wanted a way to be impactful. Just when I was planning my personal project, which is to build a science laboratory for my PPE, Corona pandemic just ravaged it, and everywhere was on lockdown. I said, okay, this does not mean that I should be at home or I should go back to my parents like the federal government said we should do. Let me just let me rethink, re-strategize on how to implement and just to live above the waters. And that's when I got to know about nose masks. I checked some videos online on how to do one, and I started practicing it till when I got funding, and NYSC said we should come, and that's how everything started with nose mask production. The community development service is for vulnerable people, not people that can afford it. So we thought of the communities that were vulnerable, that could not afford the nose masks in a way. And those were communities we targeted, and we distributed them to. Some ones we gave them to the state government. Some of them we gave them to the local persons. Those people that we know that we can distribute them to their various communities. I and my friends, we came together because some of them I study History and International Studies, so I barely know nothing about chemicals and composition, all those things. So I have a pharmacist, I have a medical doctor, I have chemists. So I brought all of them together, and we came up with formulas to producing with the standard formula from WHO to produce hand sanitizers. And that's how we distributed it to. We chose 3 wards because our fundings could not go around all the wards that we have. So we chose 3 wards, which is Gayam, Akwaba, and Cheroma. We distributed it to them. I think we produced, we produced roughly about 1,000 hand sanitizers to them. We were received quite well. Like, they were very, very happy because we received sponsorship from different vocal persons in the community, and the communities received us well. NYSC is like pulling core members out of their comfort zone. I was put out of my comfort zone because when I was back home, I got everything relatively at my fingertips. I never knew how to go out to source for fun, but now I can talk, I can address, even with my new position as a CLO, I can address a lot of people, I can meet up people, I know what to say, I know how, NYSC has taught me a lot of things. Thank you very much. And I pray that NYSC and Nigeria is blessed.
such determination to make an impact. The National Youth Service Corps provides a veritable platform for corps members to reach their full potential. Under the leadership and mentorship of the Director General, Brigadier General Shuaibu Ibrahim, corps members have all the access and support they need to make real impact in the world. We would be right back. The Director General and management of the National Youth Service Corps wish to remind the general public of the provisions of the NYSC Act, which states in Section 13, subsection 1, that any person who fails to report for service in the Service Corps in the manner directed by the Directorate or as the case may be, prescribed pursuant to the provisions of this Act, or who refuses to make himself available for service for a period specified in subsection 2 is guilty of an offense and liable on conviction to a fine or to imprisonment to a term of 12 months or both, fine and imprisonment. Subsection 2 states that any person who is not eligible to participate in the service year so participates or attempts to participate is guilty of an offense or having served in a service year and has been duly issued with a certificate of national service or certificate of exemption, as the case may be, is guilty of an offense and is liable upon conviction to a fine or imprisonment to a term of 2 years or both fine and imprisonment. All stakeholders, including corps producing institutions, prospective corps members and guardians, should be guided in their conduct and desist from criminal practices in relation to the scheme. Thank you. Thank you for investing your time with us on today's episode of NYSC Half Hour. You could always write to us on the online handles displayed on your screens right now, and we would write back. Remember, the safety of corps members in our communities is the responsibility of you and I. Until I see you next time, I am Nkem Okwogo. Stay safe.
Selflessness, Nigeria's